And yeah, just want to welcome everyone who's already here and those of us who will be joining shortly or as we speak, including Miss Amy Laughlin. Glad to have you here. So I am Anne-Marie Brown. I'm the Senior Communications and Development Director for Santa Rosa Community Health. And of course, we'll be kind of emceeing with the head of the show here today, Naomi Fuchs.
Thank you.
Yeah, our beloved and fearless CEO. And joining us today is our pal, Lori Lynn Hogan, who many of you know from over the years. And so we wanted to set this up today as, even though we're in Zoom land, as coffee with Naomi, and we can still at least see each other's names, or if you feel like sharing your face while you're here with us, we can have that sense of community and gathering a cup of coffee. And the way we've structured this, we're going to have some time. Naomi will share some information, and then we've woven in some time for discussion and conversation as we go. But please, as questions come up or comments, use that chat feature. You can drop in a comment or ask a question there, and Lori Lynn and I will be keeping an eye on that. And we'll take pauses as appropriate to answer those questions. And then when there is specific conversation, we'll ask you to raise your hand. You can do it the old-fashioned way, that works, or you can use the Zoomy raise hand feature, and that will help us all be able to have a conversation together. And since this is Coffee with Naomi, if you are in a place where you can share your face, we want to capture a little bit of this moment for posterity. If you can share your video, or for those of you who already have video on, if you want to raise your cup with your toasty beverage, we're going to do just a little cheers to say good morning to each other. And Lori Lynn's going to take a magic little snapshot.
Whoa.
Yay. Cheers, everyone. Thanks for being here. And yeah, Naomi, let's take a sip.
Yeah, yum. This mug also, I just need to acknowledge a gift from Barb McNally. Thank you, dear.
Oh, sweet.
So welcome.
Oh, yeah. So with that, I'll share my screen, and Naomi, you can kick us off here.
Well, first of all, it's just delightful to see you all here. Many of you friends and colleagues for many years, and I think clearly one of the things we all miss the most through the pandemic is being able to be together and see each other's faces and give each other hugs and just catch up on news. And while this doesn't replace all of that, hopefully it's a little opportunity to create community in a different way and catch up. So I'm going to be telling you a little bit about how we've gotten through the last year and a half now, and what's been going on for the organization and what's been going on for our patients and our community at large, and also a little bit about what we're looking forward to, what our plans are for the future. So thank you.
Mm-hmm.
Well, let's just start with COVID, because of course you can't escape the last year and a half of COVID. And so when we got the big lockdown orders in March, we all immediately pivoted, and I'm going to talk first about the telehealth visits to telehealth. And sort of the good news and the bad news is we were already experienced at telehealth. We had to do it twice already through fires. So we actually were incredibly successful to pivoting immediately, really within a few weeks. We were able to deliver 70 to 80% of care through telephonic and video visits. And so we went virtual quickly, and it was, our patients were incredibly grateful. Our staff, of course, felt protected and glad to be able to serve our patients. And it really worked quite seamlessly. Well, of course, we're still learning about how to do it better and how to make those visits more impactful and use technology to advance people's health care. We feel very fortunate that we were able to move so quickly into telehealth. And right after telehealth, we moved right into testing. We tested at least 10,000, almost 10,500 patients for COVID starting March 13th. And we focused on our patients, but also the community at large. We set up systems to message all of our patients through text about when and where they could get testing, and encouraged everybody to get testing. At that point in time, especially in the beginning, it was really about community testing and reaching as many people as possible, not just patients who were sick, so that we could get a sense of how the community was doing, and to try to mitigate the spread, of course. So right now, however, we have pivoted a bit, that to all the testing is being done in the clinics. We're no longer testing in a big community-wide setting. We've just integrated it into a normal part of primary care, which it's going to need to be forever, I think. All of our public health services now really are being integrated into primary care. So in the whole year of 2020, about 50% of our visits have been telehealth. In 2019, it was about 1%. So you can see what a huge change that's made to our culture and the way we deliver care. And then vaccines. So January 30th, vaccines came on the scene. The first thing we did was we had a huge Saturday clinic and vaccinated 900 people in one day. All of the 65 and older patients that we had. It was really quite amazing at Vista. The crowds were, it was really well managed. There were lots of people, but we had great systems for throughput. Everybody was so grateful and pleased to be able to have those vaccines. And of course, we started vaccinating our staff as well. And then in February, we opened up a community-wide vaccination site at the Sonoma County Fairgrounds, where we were vaccinating between 200 and 500 people a day. We did outreach to the community. We reached out to businesses and schools. We received help from the state of California. They provided us with, I think it was about 25 nurses to start with, to help with this mass vaccination effort, because we really couldn't pull people out of the clinic to do this. And we'd had a close collaboration with Sonoma County and also the Sonoma County Medical Association, who we partnered very closely with. And then in April, we realized that our vulnerable community in the Roseland area really wasn't being reached adequately. So we opened a second site at the Roseland Library, and it was very popular. They did a beautiful, the old Roseland Library. So I don't know if any of you have been there. They did a beautiful job kind of fixing it up and making it a welcoming space. And we really focused on the bilingual, bicultural community that needed a safe local place to get their vaccines, to get their questions answered. So while we also outreach to the homeless encampments and shelters, again, I feel like the vaccination effort in particular was a really successful community-wide collaboration with all the health centers, the county, the Sonoma County Medical Association, and then others who really stepped up to help out. So now again, we are no longer, now that there is availability of both testing and vaccines through multiple venues, including pharmacies and other places that are easy to access all around the county, we're no longer operating those sites, and we're integrating vaccines into normal primary care, where people can have those conversations with their trusted provider and get the vaccine as a part of their regular primary care visit. There's still a lot of misinformation. Having that personal time with a patient really gives a great opportunity for an intimate conversation with people about whatever questions or concerns or things they've heard or read, to help try to address whatever misinformation is out there. And I'm pleased to say that we are now at 98% vaccination for our employees. We did a great job, I think, doing education, doing support, and then, of course, the statewide mandate for healthcare workers really helped that as well. Thing I missed on that, Anne-Marie, that you feel like is important? I think
no,
county.
I think that's it. I mean, what's really, it's interesting, at least for me, been listening to you and having lived through this 18 months, is thinking about from the community service perspective, the scope, right? We can go through this in 3 bullet points, but when you think about the number of people that we've been able to touch and serve through these tests and telehealth visits and vaccines. I think that gives a snapshot of Santa Rosa Community Health's role here in the community.
Yeah. And really, I think also thinking I see, if Kathy is on the line, as well as others, our director of nursing, and Kwatlikwe, who did all the purchasing and organizing of all the vaccines and the testing equipment, a really big shout out to the staff who stepped up every time. Mm-hmm. So thank you. Yeah. Okay.
Oh.
So I think it's important to put this in the context of who who were the people in our community who got COVID. And you've probably read these in the newspaper and you've seen some of these statistics, but I think it's really important to recognize that the people who were most vulnerable before COVID were the most vulnerable during COVID. And that's really clearly demonstrated when you see that people from our Hispanic Latinx community represented 57% of our COVID cases, while they're only 27% of our whole county population. So people often ask, why? And the data that I've seen and the understanding that I have really is the why is that the Latinx community are our essential workers, and they were most in harm's way, whether it's at grocery stores or restaurants or in the fields or other direct service where they're dealing with the public on a regular basis. The people who are essential workers in that sense, in terms of the service delivery outside of healthcare, meeting everybody's needs, were the most exposed and thus often the most vulnerable to getting COVID. But COVID also had a big impact on, okay, go to the next, other aspects of people's health. We've seen an increase in chronic disease because people haven't been able to come in for their regular visits. Doing things by phone helps, but it's not quite the same as having that opportunity to do the testing, do the counseling, provide the resources that people need. Plus, I think the isolation has been hard on people and has increased their prevalence and their disease burden. So we had an increase of 11% in patients with hypertension, so high blood pressure. Out of our 40,000 plus patients, 6,500 have hypertension. About 26% of our patients have some kind of hypertension. So, and then we saw a 6% increase in patients with diabetes or uncontrolled diabetes. So again, this is not good for our community at large. It is not just COVID that's causing illness and people not being able to live their most full and healthy life. These chronic diseases have increased as well. And then as well as asthma, uncontrolled asthma, increased by almost 22%. Really, really a tragedy for the projection on these people's lives and the impact of chronic disease on their lives.
And Naomi, I think it's interesting when you look at the number of patients with asthma, that to me is the one that really highlights that in addition to COVID, we all know this because we're living here, but Santa Rosa and Sonoma County have been through years of natural disaster, right? And so we're seeing these layers of unfolding stress, situational stress, impact on economic situations with increased housing costs. So when we think about stress and the impact that can have, and you see our increase in patients with hypertension, in particular patients with asthma, just from 2019 to 2020, in these years of of smoke impact that we've had. And in my grant writing role, I get to talk to a lot of smart people who in population health and who are looking at the data and talking about it's really going to be years before we fully understand the impact that COVID is having beyond the virus. So these kinds of numbers that we can look at are leading indicators that we're starting to see, and we can start to see some disparities as well between patients who have insurance versus patients who don't have insurance, and that those the numbers are even more startling in those populations. So I think the message here, one thing we wanted to share is, as a community, it's important to understand that COVID is the headlines, and here's this unfolding story that's happening as well, directly in the lives of our patients. So with that, I think we wanted to take a pause here and just have a little bit of conversation, see what do you notice, what questions come up for you as we share this information, or you think back on the last year and a half and COVID and what you're seeing in the community or in the work that you're doing. Feel free to just unmute yourself or drop a comment in the chat.
Hi, good morning.
Good morning.
My name is Louisa. I'm a psychotherapist, and I've been seeing a lot of nurses, and there's a lot of stress because of either tension, lack of teamwork, just fear, and extra, burden of dealing with home and work. And I just thought I'd ask for that to be addressed. So thank you so much for having this. Thank you.
Yeah, no, I'm really glad you brought that up. I think we'd be remiss if we didn't talk about the impact of all of this on workforce. And nursing are certainly one of our essential, all our staff is essential providers, but there's quite a shortage of nursing, and the pressures on them have been tremendous. I'm very happy to say I think our staff feel like they've been supported and protected. We've been really strict about all of our safety protocols, and I think in the whole year we've had one transmission from patient to a staff person, and really that person hadn't followed the protocols. So we really have had almost no transmission from patient to staff during this whole 18 months. But that doesn't mean that people aren't scared and it isn't stressful. It absolutely is. And we're talking about that a lot right now with all of our leadership about wellness and resilience, and how we support people to get through this and keep on. We have a lot of people, a lot of providers taking sabbaticals. There's a lot of people just need a rest. People are tired. And so I think, leading with our heart and our compassion for our staff, I think that's a really great point, that they are under a lot of stress right now.
Thank
And
you.
similarly, yeah, Louise, and similarly, for our patients, there is a growing conversation in the community about youth mental health. There's been some really excellent, the Career Technical Foundation and Community Foundation of Sonoma County sponsored a survey. They launched it following the 2017 wildfires, called the Youth Truth Survey. And they were, because of everything that was happening, they were able to continue that research, and our youth are definitely struggling in this time of isolation in their very formative years. So again, one of these long-term pictures that we really need to be watching against the backdrop of the time when your providers, as Naomi spoke to, are challenged themselves. So being able to gather in spaces together is important for everybody.
Any other comments or questions, feedback people would like to share? I know it's a large group and you don't all know each other, but we're very open to hearing whatever you have on your mind right now about what you've learned so far or what you've experienced.
And Lisa, I see that you unmuted yourself. Did you want to add a comment or question? Or Elliot?
I think he's driving.
Yeah, good morning, Naomi. I'm thank you for doing this. I'm not being shy. I'm in the car. I was curious about behavioral health, and know that that's been a huge area of service for the health center. And like many health centers, the shift to telehealth in behavioral health has been significant. And I'm wondering if you could comment on what that means, not only now, but what you foresee it's going to enable you to do on the behavioral health front through telehealth.
Right. No, it's been fantastic, really. You know, the no-show rate for our mental health and behavioral health visits went down dramatically. It was like coming in for those visits was really hard for people to justify, to leave work, to do all that. But when we switched to video visits for mental health and telehealth and behavioral health, it became an essential lifeline for so many people. I mean, our staff were somewhat overwhelmed. The demand has increased a lot. It's been hard, but I hear so many stories from providers about how being able to reach someone through telehealth has just provided opportunities they think they might never have happened before in terms of being able to help people through difficult times. So we do think that this, and I think for all of our services, that some form of telehealth will continue into the future. I mean, this isn't that revolutionary, right? Kaiser's been doing it for 20 years. So we see the value in a mixed model, and in particular for mental and behavioral health services. The only part that in behavioral health, you know, our behavioral health clinicians really partner closely with primary care. And so it's still important to have some of those in-person visits, because something might come up during a medical visit that a medical provider says, you know, I think I'd like to introduce you to our behavioral health person. I think they could really help you with this issue, or I could, you know, that integration in time. Yeah. So I think we'll see telehealth continue into the future, and the state is supporting that. I think we got a hand raised from Pamela and also Kathy. Yeah.
Good morning. And first, I just want to express my gratitude for all the fabulous work that you and your staff are doing in the community to help people have healthier lives. It just warms my heart, because I know how hard it's been through all the different kinds of crises we've faced in the last 3 years. And I've always been impressed by how well you take care of not just the community, but your staff as well. The question I had for you was, have you gathered any patient reactions or stories to this new way of experiencing healthcare? And are there any that you can share with us?
Yes, I don't have I have more of the stories from providers, so it's already secondhand, and we do have a couple providers online, so if they want to add a story, you can, Carla. But I think there's been both. I've heard stories both for people who say, you know, I had this moment where probably a patient would never have come in. They were too shy. They were too shut into their home. They just we never would have connected. And now we had an opportunity to connect, and they feel safe in this environment. And we have other times where it's a challenge, right? People feel either their technology isn't that great, or they don't have privacy in their home, and it's hard for them to have a private visit in their home, or they have some, you know, they don't really, they'd prefer a telephone visit than a video visit because they don't want to share where they're living. So we have to really balance the needs of the patients in a way that meets them where they are and what they need in that moment.
Mm-hmm.
Yeah,
Carla?
so I want to reiterate that I have a handful of patients who have severe agoraphobia or sensory defensiveness and basically live in their homes. And I've been able to connect with them in a way that is so powerful and wonderful for them, wonderful for me. Actually helps me feel like I'm doing the work I want to do in my career. And so it's been incredible to be able to do these telephone visits and video visits for behavioral health needs.
So that's Dr. Carla Longchamp, our medical director for our Dutton campus, wonderful leader and physician at Santa Rosa Community Health. Well, thank you for those questions. I think that it really helps to bring out the color commentary, right, to make it real for all of you. So I appreciate your inquiry and your interest.
Great. So with that, we can move on to the next information that we want to share with you today. Because against the backdrop of COVID, we're also celebrating our 25th anniversary this year.
Yes, and we did a full refresh of our vision and mission and values, as well as our strategic planning for the next 3 years. So as many of you or some of you know, I've been here at Santa Rosa Community Health for the last 21 of the 25 years. So it's really a proud moment for me to sort of see where we've come and and to think about where we're going next. So our new vision is that we will be a just and healthy community where all people can achieve their full potential for health and well-being. I just love that vision. It really encapsulates so much of what we believe in and what we're trying to create here in Sonoma County for everyone. And then our mission pulls out of work we did quite a while ago about our branding around being united in heart, health, and justice. Santa Rosa Community Health provides excellent, comprehensive, culturally responsive healthcare that meets the needs of our diverse community. So this first phrase, united in heart, health, and justice, has been our kind of internal rallying cry for quite a while, and it really resonates with our staff that we work together collaboratively with each other, with the community, with our CBO partners. We lead with our heart. We lead with love and compassion for all people. We deliver healthcare, and why? Because we believe it's fundamental to a just world and a just community, to social justice. So it's a little bit of how we do it, what we do, and who we do it for. So those are our revised mission. And then we also sort of did a little buffing up of our values. I think strongly at the top of our values is justice, that everyone deserves the right to a full and healthy life. And partnered with that, of course, is equity. Everyone should receive the highest quality care that honors them and meets their unique needs, right? So this is equal access to care, equal quality of care, equal length of life, regardless of where you live, how much education you've had, or what your income is. So we also believe strongly in clinical excellence. Continuous learning and innovation is essential for excellent care. Compassion is one of our values. We really, every time I go through our values with our staff, this value of being a loving and safe environment always resonates with people, that we are a sanctuary for people where they can come and know that their needs will be met without judgment. And that goes to respect, that all who enter our doors are heard, valued, and respected. Everyone deserves care. So, and we do this in partnership with our patients, with the healthcare team, and of course with our community, and that we are responsive to the ever-changing needs as they develop with the patients and the community that we serve. So those will be our guiding guideposts, I guess, for our work and how we do our work going forward. Now, we did come up with 4 pretty big strategic priorities I'm pretty excited about these two. They really resonate and reflect our values. The first is that we're going to advance health equity. And this really is about meeting the needs of our community. So we're going to focus on strengthening our mental and behavioral health services. We are also pivoting a little bit to really develop programs and services to care for older adults as our communities age. And we are really working hard on developing a trauma-informed culture that address the post-disaster needs and prepare for any future traumas and disasters that might happen. And of course, social determinants of health. We've learned a lot over the last many years about how income, education, and social supports impact people's health and health outcomes. So we'll continue to screen people for adverse childhood experiences and link them to services that support their health and well-being. Now, we also want to eliminate health disparities through high quality care. So this means prevention, strengthening patients' access to preventive services, cancer screening, immunizations, and well child care, all of the preventive medical care that's needed to make sure people stay healthy, as well as chronic disease management. As you saw, many chronic diseases were already increasing. So we're going to ramp up our emphasis on diabetes and hypertension, as well as other chronic diseases. And then last but not least, in our health disparities pillar here, priority, is that to expand and integrate care coordination and community health workers. I've been saying this for years and I keep on saying it. You know, people come to the medical center, to the clinic 3-4 times a year. They make health decisions every day. And we need to have staff and resources in the community to support people's knowledge and to support people's empowerment to make healthy choices for their lives. Our third strategic priority is service excellence. And we're going to build on a lot that we've learned through the pandemic about using technology to connect with patients. We're setting up systems so people can sign up for appointments using their apps or using texting. We're going to be sharing health education through texting. And as we talked about earlier, expanding video and telehealth capabilities, as well as strengthening our team-based care. And last but not least, of course, we want to inspire joy at work. It's been an incredibly tough, and I will say 4 years for all of us since we lost the Vista campus in 2017. So we need to support people, give them time for laughter, for connection, for as well as work. All work and no play, as they say. So we're going to be working on wellness and appreciation, recruitment and retention, as well as, of course, diversity, equity, and inclusion in all aspects of the work we do. Well, that's some of the things where we're headed. And there's, of course, lots of detail behind that. Everybody's working away on their action plans and key priorities while they're juggling still the COVID response.
So with that, this is another place where we want to take a pause and just say we've offered a lot of information here. You know, Naomi talking about our strategic plan, and it was really a rich opportunity to be doing the strategic plan while we're weighing our 25th anniversary against the backdrop of COVID and all the fires. And I think that really informed where we've landed. So again, we're curious. We want to hear from you. What are you thinking about in terms of the health of our community, questions that are coming up? Amy?
Yeah, thank you. Hi, Emery, and thank you, Naomi, for making the time this morning to do this. One question for you is around staffing and finding talent to work with you and finding equity and inspiring joy. One of the things that we hear about a lot is the difficulty, you know, in hiring in medicine. And I wonder how that has changed and if you're seeing innovation or being part. I know how well you work with partner organizations and all of the amazing things you do, but if you've seen or been part of any kind of creative idea creation or solutions to that?
Well, I really appreciate that question, and I'm open to any suggestions people have because it's a tough nut to solve. You know, we have definitely learned how to be more flexible with mixed schedules of in clinic and working from home, and that's been particularly helpful for people with young children as they try to navigate the whole educational system and its ups and downs. We are learning how to do more in groups for patients so that we can, sometimes it's in Zoom, often it's in Zoom, we're still under pretty strict protocols, but so that we can reach more people with fewer staff. But in the end, you still need doctors, nurses, medical assistants, billers, everybody to get the work done. So it is quite challenging. It's really, you know, hospital systems, Kaiser and Providence and the rest are offering often a lot more money than we can afford to pay. So we're trying to build our connection with our mission, with our sense of community. People at our staff are incredibly mission driven. Whenever we do employee surveys, that is the #1 thing they say about why they work here, why they love working here, is our mission and caring for their community. So we're going to have to keep on leveraging that. There are some innovation things happening more on a statewide level in terms of building pipelines. We have 2 residency programs, which have been fabulous, both a nurse practitioner residency as well as our collaboration with the Santa Rosa Family Practice Residency. To help with some of that pipeline. We're doing a lot more in terms of having interns to try to help build that one as well. And so we're looking at other ways we can do to kind of grow your own, build our pipeline for staffing.
Yeah, understand. Thank you.
Great question.
Yeah, thanks, Amy.
Other thoughts? What do you think? Are we headed in the right direction? Are these the right priorities from your perspective? Did we miss anything?
Yes, from Barbara McNally.
Naomi, can you share more about the health center's response to the other big thing that's happened in the last 1.5 years, which was the real rising of racial justice and a desire for companies and individuals to be doing work around racial justice? Can you talk more about that?
Yeah, I think there's lots of different levels of that. There's sort of from the personal up to the organizational. And, you know, when the Black Lives Matter movement was really coming on strong and there was a lot of conversation, there were a lot of forums. I think having dialogue is what's most important. So we supported and created opportunities for staff to share their concerns, to share their beliefs, to demonstrate, to have moments of silence, to honor and respect the pain that so many of us were all feeling around the racial violence that was going on. And we also have our own internal diversity and equity and inclusion committee, and trying to empower them to understand and say, where are we falling short? How can we improve? It's, you know, a significant path. It takes time. People want, of course, to see more diversity in our leadership team. Understandable. We recently hired our new head of HR is actually Chief Human Resources and Diversity Officer. So he is now Gustavo Paredes. So he is now empowered and leading our DEI efforts. And I think what we're trying to do is say, what does this mean, not just in words, but in actions? What does this look like in policy? What does this look like in hiring and recruitment practices? If we just put that lens on everything we do, as well as how we care for patients, as well as how we communicate, it's a important journey for us all to be on.
Susie?
Thank you, Naomi, for this morning and for those comments about diversity, equity, and inclusion. Many of us are in organizations where we're educating ourselves on our biases and understanding some of the systemic issues, but we're struggling to make specific, tangible differences in our policies and practices. So can you cite a specific thing that you've put in place that is a tangible example of that?
Well, for example, in our recruitment efforts, we're revising, how we market, the language we use, where we place our advertising to make sure that we really get a broad and diverse pool of candidates. We're making sure that our interview questions and the way we handle all that is fair and doesn't reflect as much as possible, tries to eliminate some of the bias in how hiring practices are done. We're, of course, always looking at our compensation and making sure there's internal as well as external equity around that. And then we're working on developing opportunities internally for safe spaces, right? Again, people need to feel safe to have these conversations in the workplace and share what they're seeing in the community. Griselda Correa just joined us, and she's our community engagement manager, and she's working with the community to say, how is Santa Rosa Community Health engaging with our CBOs and other communities? Are we being inclusive? Are we listening and giving us that feedback about where we could be stronger? So it's very much incremental. I know it's not going to transform things overnight, but I think it's that growing awareness and intentionality to learn and grow that is what matters.
Yeah, I was thinking, Naomi, that and Susie, you got to it there, that it's really listening. This work is so big, right? And we're living in such an important time with so much unfolding, and being able to both be in an organization where you have a job to do and there are job roles and a mission to complete, and at the same time have this deeply personal and significant societal shift happening is this challenging space to be in. And I think having that openness of mind and openness of heart is really the most profound thing any of us can do, is be willing to say, oh, maybe I don't know. Maybe I don't know what to do. And I need to be willing to hear that, even though I'm a leader in my field, or I have 20 or 30 or however many years of experience, and being able to show up with that beginner's heart is really important. Other questions and observations? Pamela.
In terms of community wellness, I was wondering if you could take a few minutes and speak to the kind of work you're doing in the community to help people build their own resilience. And I'm thinking specifically about the Sonoma collaborative, I'm not going to get the title correct, I'm sorry, collaborative efforts to teach people their own self-management of trauma and stress in terms of mind-body work that you've been doing, because I think it's a valuable piece for partnering with community members to strengthen their resources internally and externally to be able to better cope with some of the things we're facing.
Yeah, thank you, Pamela. Yeah, that's been an incredible initiative led by Anne Marie and Griselda. It's the Sonoma Resilience Collaborative, and partnering with the Center for Mind Body Medicine, we've trained over 200 people with 8 days of training that was provided for free through the generous support of donors to be facilitators in mind-body medicine techniques. So it's both about self, but it's also about community. And I think that's always really important to remember, that we don't really heal alone. We heal in community. And so it's about learning how to self-regulate, how to communicate, how to deal with anxiety, how to deal with depression through all different kinds of mind-body techniques, and I'll let Griselda and Anne-Marie speak to the specifics of that more. But it's also about creating opportunities for people to be together, even if it's on Zoom, so that you don't feel alone. Loneliness is another chronic disease that we really have to address, and that we need to heal in community.
Yeah, I'll ask for Griselda to share some specific comments. I can say this started after the 2017 wildfires, and we've learned so much about when, against the backdrop of everything changing, what it takes to be able to build this kind of community, and when people are ready, willing, and able to receive. And the layers have just kept coming. So we've learned a lot through the fire recovery and COVID recovery. And Griselda, you want to give a little snapshot of the pilots that we're doing now? We've really, just like Santa Rosa Community Health, have continually been pivoting to what do people need in the moment? What's their readiness to receive? Can we even meet together in groups or not? And Griselda, our communications and community engagement manager, has been my partner in really leading the current efforts that we have going.
Thank you. And thank you, Pam. You're a trained facilitator as well, so you can totally speak to this as well. Currently, one of our efforts is working and doing a pilot with our community-based organizations that, just like we're seeing our first responders, second responders, dealing with trauma and other difficulties that we've experienced during the pandemic. So have our community-based organizations and community health workers doing much of the work in community, and hearing the stories of folks that have lost people due to COVID, and many of them have lost folks as well. So our pilot is really focusing with 4 organizations right now: Latino Service Providers, Center for Wellbeing, La Plaza Cura Project, and Corazon Hillsburg. And really, our facilitators are plugged into these organizations to then work with organization leaders to identify a process that's going to work for their organization. You may have heard that we're doing workshops and skills groups, but really it's the facilitators meeting with the management over at each one of these organizations and identifying what is the need of your employees at this moment. Is it a training the manager on how to lead some techniques? Is it running a group, or is it just hosting a workshop or holding space for folks to drop in? Each one of the organizations that I mentioned is taking a different approach. And that's what trauma-informed approach is really taking the time to step back, to process and identify where we can support, and really not allowing self-care to become an overwhelming thing that we have to do, right? But allowing us 5, 3, whatever minutes we have in our day to really take time and do what it is that we need to bounce back during our day. So thank you.
Thanks, Griselda. And that really is a perfect segue. It's this beautiful effort that was funded by the Community Foundation of Sonoma County, by Kaiser Permanente, Redwood Credit Union came on board, Medtronic, and others to make this available. And I dropped in the chat, socoresilience.org. Is a community hub that we set up where people can access recorded tools. It's kind of like a social media platform with no advertisement, and it's just people who are interested in accessing some mind-body tools and being connected with each other. And so while we're doing this pilot, the 200 people that we trained are also out and about, like Pamela, in community doing what they do. For example, the Sonoma County Juvenile Probation Department put 3 people through the program, and they've been able to run groups with their staff, and they have a waiting list. And this has just become a part of how they are strengthening their capacity to do this work. And that's really where we wanted to close today, was, you know, being a warrior for health and an active and engaged citizen takes a lot. It takes heart and health. And so we're curious, what are some of the things that you're doing to take care of yourself, or that you've seen others doing? And I've been a teacher, so I'm good at doing like the teacher's pause for a minute while people go, should I say something? Should I not say something? I'm not sure.
I'll go, Anne Marie. Oh,
Elena,
I see somebody's hand. You guys know Raymond Dougherty with Kaiser Permanente. He's our spiritual care director, and he sends out these soul snack messages, and they're really just a mind body moment, and it's something that you can incorporate easily into your busy workday. So it's, you know, just a reminder of how to stay present, stay in your body, and keep your feet on the ground.
Great advice.
I love that, Elena. We might have to borrow that soul snack. Pamela?
I just wanted to say that I'm grateful for the opportunity of having been trained as a facilitator for the Sonoma Community Resilience Collaborative. I learned a lot about the detrimental impacts that chronic stress has on us and our health, and specific skills that don't cost any money, that don't require any equipment, that don't require anything other than a little bit of time and regularity to help us get through things. And I really do credit the skills that I learned in mind-body medicine for getting me through the COVID situation, because I'm a person who lives alone. And so being, especially when we were not really when we were invited to stay home a lot and not really go out and about, a lot of those skills were very helpful in staying present and staying positive about what was going on. So I applaud your efforts to continue this initiative, and I'm looking forward to a time when we can meet again in person.
Thanks, Pamela. And one of the things that we're doing is, you may have heard, we launched our Epic Trail Challenge, again with the creative support of our pal Lori Lynn Hogan, as a safe outdoors way for us to stay connected and be healthy and have a goal to strive for and connect with this beautiful nature that we have. And right now we're doing what we call our Healthy Hiking Challenge. So Lori Lynn will drop a link in the chat to how to sign up for that. And really, it's just an invitation.
Whoops. We lost you, Anne Marie. Anyways, there's the Healthy Hiking Challenge. It's not a fundraiser. It's just a way to motivate and connect and get outdoors and move your body. So I'll wait for Anne Marie to log back in. But mostly I just want to thank everybody for joining us this morning. I know it's something a little bit new. We're trying just to connect with people in different ways. And I really hope that you all are taking care of yourself, even though we haven't heard so much about it yet. And if you haven't, maybe you should make a plan. What is it that would feed your soul? What would fill your cup right now? Because we do have to take care of ourselves while we serve others. And if you have any thoughts or want to write those in the chat, that's great too. And maybe we'll all unmute and just go around and see if people have a little one-word closing. There's only 20 of us now, so we can just share just for a moment. Oh, now people who are shy are going to leave, but that's all right. Any one word? Shall I call people around the box? All righty. So why don't I start with Elena? I know you just talked, but how about just a word on how you're doing right now?
I was going to say gratitude.
Oh, thank you. Good for you. Gary Johansson, nice to see you here. You got a word for us? How about Barbara? We'll come back to Gary. McNally. There we go.
Yeah, I couldn't know how to talk. I find healthcare challenging right now because as a teacher, I spend a lot of time in my chair, way more than usual. So it's a challenge.
Yeah. Jeff, do you have a one word for us? Okropeki.
I'm sorry, I had to step away for a second. I didn't hear the question.
Oh, that's all right. We're just closing with one word about how you're doing, how you're feeling.
Resilient.
Good. Great. We need your energy. And Cindy?
Inspired.
Ah, great. Is it Lisa who's LG?
Louisa.
Louisa.
It's Louisa. Yeah, I don't know. I don't know if this is appropriate, but daily walks.
Daily walks. There you go. Karen wrote hopeful in the chat. Lynn?
I'd say inspired and striving for balance.
Yeah. How about Tarek?
For me, it would be reflective.
Thank you. Vincent?
Feeling a little meditative today.
Yeah. Haley? Haley, you want to join us? How about Marie?
Gratitude.
Thank you. And Beth wrote proud. Yeah, go Beth. So, and Pamela wrote grateful. So thank you. These are wonderful words to end on. Hope, being grateful, being proud, being reflective. Our little, what did you call them? Soul
snacks.
Soul snacks. So.
And thanks, Elena.
We're going to hang on to that one, Elena. And thank you for the congratulations. Yes, we are very excited to be celebrating our 25th anniversary here.
Well, thanks everyone for joining us today. We wish you a wonderful day and our beautiful fall weather happening here in Sonoma County. And I encourage you to keep connecting and feeding your hearts and souls and minds so we can all keep doing this good work together.
Have a great day. Thanks again. Take care.